As you can see, I titled this presentation, How Civil Society Organizations Address Water, Sanitation, and Hygiene Inequities in Brazil. I always spell out that acronym, but I'm pretty sure that people here know what it means. It's just for safety. And my research had a broader scope, of course. I finished my PhD in geography, so I was looking at a lot of the theory behind the theoretical framework that I used for this research, which I'll touch on briefly, but then adapting my presentation to today's seminar, I decided to focus more on one of the objectives, which was to look at what civil society organizations do to support communities with limited access to water, sanitation, and hygiene in Brazil. And I'll explain why I selected Brazil. So first of all, I am from Brazil, but other than that, I find it a very intriguing case because even though it is the country with the largest supply of fresh water in the world and the 9th biggest economy in the world, there are 32 million people without access to safe drinking water in Brazil, according to official data. And there are also 89 million people without access to safe sanitation. So to put that in perspective, it would be the equivalent of having the entire population of Canada, or approximately the entire population of Canada, without access to safe drinking water, and the entire population of Germany without access to safe sanitation. And these two are high income countries. Brazil is an upper middle income country, but they all experience inequities in access to water, sanitation, and hygiene. And why is that, or how does that happen? In my research, I tried to understand that by using Brazil as a case study, but also making a dialogue with limited but existing literature on WASH inequities in high and upper middle income countries. So for today, I'm going to present a brief overview of the research program, just so that you can understand how I came to the data that I'm presenting today. I'm going to situate how I look at civil society organizations by going over what is a civil society organization, or a CSO, as you will see I refer to in this presentation, and what do we know about them in WASH and how they act in this sector. I'm going to cover some of the key findings just to situate what access to WASH looks like in the research locations, but I'll focus on the civil society organization initiatives, and then take it back to the research question, which is, what is their role after all? What is the role of civil society organizations? Then touch on some implications. What can we do with the information that I'm presenting? And then just go over some of the future research that I plan on doing with this. So the building blocks of my research problem are 4. The first one is that safe water, sanitation, and hygiene is key to health and well-being. There's a lot of literature on that. And my focus on the health aspect comes from the fact that I come from health geography. I approached this topic from health geography. And there's a lot of literature showing how inequities in WASH affect negatively health, and not so much, but some literature showing how it affects well-being. The second building block is the idea that I touched on briefly already, which is that WASH inequities exist in high and upper middle income countries, but this literature is not as explored as the literature on WASH inequities in lower middle income countries, low and lower middle income countries. And then thirdly, the fact that Brazil is an example of these upper middle income countries, and an intriguing one because it has abundant natural and financial resources. So we ask ourselves, why is this a problem that has such high absolute numbers like the ones that I exposed earlier? And then finally, the fact that civil society organizations step in to address WASH governance shortcomings. And this was pretty clear during the COVID-19 pandemic. I will give you some examples in just a few minutes. So having that into consideration, there were some gaps in knowledge that I identified when I was designing this research. The first one being that we don't know much about WASH inequities in high and upper middle income countries. So my first research objective was to describe barriers and facilitators in access to water, sanitation, and hygiene in low-income communities in Brazil. Then secondly, there's a gap in knowledge on what well-being means. I was really interested in this concept of well-being because in the subdiscipline of health geography, there's a lot of discussion on what it means and how it differs from health. And I'll give you a sneak peek of what I concluded through this research. So my second objective was to explore the impacts of inequities in access to water, sanitation, and hygiene on the well-being of low-income communities in Brazil through a theoretical framework called political ecology of health, which I'll introduce in a few slides. And then finally, there's a gap in knowledge on the role of civil society organizations in the WASH sector. And this is because there's a lot of researchers in the WASH sector that partner with civil society organizations to reach marginalized communities, but there's not that much research on the civil society organizations themselves, putting them at the center of the analysis. So my third objective was to investigate solutions to water, sanitation, and hygiene inequities implemented by civil society organizations in low-income communities in Brazil. And this is the objective that I'll focus on for this presentation. So just briefly, the theoretical framework that I used to understand, analyze, and interpret this research problem was the political ecology of health, which is present in health geography. And this theoretical framework looks at how the unequal distribution of natural resources, or as we call them, environmental health, impact and lead to inequities in health outcomes. So power is at the center of analysis. We look at scale a lot. We consider that these phenomena that we study, they happen at multiple scales at the same time. So they happen at the household level, the community level, the regional level, the national and international, and they are mutually influence each other. It looks at history, it looks at narratives. So I talk about health narratives and well-being narratives. So different groups at different, who are experiencing power at different levels will have different narratives about how they experience health and well-being and how. And it considers place, which is space embedded with meaning. So you'll see a lot of that in the quotes that I will use to illustrate some of the themes that I explored here. So for the research design, I conducted a multi-site case study in the metropolitan region of Rio de Janeiro. Rio de Janeiro is probably the most famous city in Brazil, and I recommend that all of you visit it if you go to Brazil. And it's also where I come from. I actually come from another municipality, but it's from the state of Rio de Janeiro. And I designed this research using an integrated knowledge translation approach, which aims to have the research partners mobilized throughout the entire process of research. And I had a CSO partner when designing the research, and this CSO partner was located in the municipality of Duque de Caxias, which is the blue municipality here in this map. And for that reason, we decided to focus on other municipalities within the same region. And I used qualitative methods. I did key informant interviews with 7 leaders of civil society organizations operating in these communities, and focus groups in 3 of these in the 3 municipalities, which ended up having 24 participants in total. These focus groups were with residents of the communities, but the majority of the key informants were also residents of the community. And just before I go to that, let me just situate you here. The yellow municipality here is the capital of the state, the city of Rio de Janeiro. The blue one is Duque de Caxias, is the second biggest economy in the state from the municipalities, of course. And then here in green, we have the municipality of Japeri, which is the more remote and rural community in my research. So the reason why I selected these municipalities was because initially our first research partner was located in Duque de Caxias, which you can see here has somewhat average for the region, of course, indicators of water supply, sewage collection, and sewage treatment coverage. Water supply is above 50%, but pretty low considering other municipalities. And sewage collection and sewage treatment are very limited. And then we selected Rio de Janeiro because from a geographical lens, we were interested in the capital periphery dynamics because Rio is the capital of the state. So a lot more industry work happening there and services, whereas these other two municipalities are in the periphery, metropolitan region. And Rio has consistently high indicators. Of course, sewage treatment is very limited, but for the region, you can see here that is among the highest. And then we selected Japeri because it has consistently low indicators. And this is from the official organ that is responsible for reporting the data of wash coverage in this region. But first, what is a civil society organization and what do we know about their role in water, sanitation, and hygiene? So what is a CSO? Civil society organization is also referred to with some interchangeable terms such as non-governmental organizations, the voluntary sector, or the third sector. And they are non-profit organizations. They are formed voluntarily, and they have the goal of improving the standards of living of the less fortunate. And more recently, and by more recently, I mean the 1980s, these organizations gained importance in the United States and in the United Kingdom with the rise of neoconservative political movements or neoliberal agendas, where there was a project of reducing the state, therefore dismantling the welfare state. So reducing the social services that the state offers to the society. And then by leaving these spaces of services open, actors like civil society organizations stepped in to offer these services because the needs don't stop, especially among marginalized communities. So in this context, in the global north, they gain importance. But in the global south, of course, we don't have the same trajectory as countries in the global north and in North America, where there was a solid period of policies of welfare state. So the relationship with civil society organizations is a bit different, but they still offer services that are not offered by state actors. So they fill the gap left open by the state in providing basic social services like food security, water, sanitation, and hygiene, education, and cultural services, and so on. And then what is their most meaningful contribution? According to Jennifer Welch, who writes about the shadow state, where she conceptualizes the fact that these organizations step in to provide social services as them being part of this shadow state. She says that they are responsible and they're capable of proposing new political economic forms of social organization by expanding democratic participation. So they're able to cause social change. And by expanding democratic participation, I mean providing the basic services that people need so they can participate more fully in society. But there's some criticism, of course, because some might see civil society organizations as from a rosy lens and assume that they're all they're all actors that just cause positive impact in society. But of course, there's other sides to it. And there's critical scholarship that says that the civil society organizations can sometimes prioritize donors' interests. So they might change the way they operate and the delivery of the services they operate to please donors, international donors, and therefore lose some of the meaning of what they're proposing. They also say that civil society organizations, because of their formality, sometimes they need to maintain peaceful relationships with governments. So in certain places where you have more authoritarian governments, they might have to please these government actors, therefore reducing their capacity to promote meaningful social change. And they might also have, in certain places, predatory behavior towards funding. So some civil society organizations are formed to access funding and not really to deliver services. That's why I have this photo here, which I'm sure that you were confused when it showed up at first. And some say also that they are used by the elites to delay social change. And that is from the point of view that charity is just one of the mechanisms that we have in capitalist societies to maintain inequities in place in the sense that what they do is to address immediate needs without promoting autonomy, without promoting change in the long run, and promoting these changes in political economic forms of social organization that I spoke about earlier. And then there's also this vision of grassroots NGOs or grassroots civil society organizations versus non-grassroots organizations. So some civil society organization scholars say that this distinction is very important because those civil society organizations that are formed through grassroots social movements, they are more likely to promote positive impact and social change than other ones that are not really connected to the territories. They don't understand as well the needs of the communities, and can more easily fall into the traps that these scholars have highlighted as potential criticism to civil society organizations. And then what do we know about their role in WASH? One case that I used to illustrate that is their work during the COVID-19 pandemic, obviously because one of the main messages of public health was to wash your hands frequently, and certain communities around the world cannot do that because of the limitations that we know exist through WASH inequities. And so the civil society organization to support people in guaranteeing or trying to not be contaminated or contract COVID-19. So where government actors failed or acted to delay evidence-informed action, like it was the case in Brazil, it was the case in the United States with all the misinformation about what medications were used and whether or not to social distance and so on, the civil society organizations were really important in providing immediate relief. And they did that by donating hygiene supplies such as personal protection equipment, masks that were appropriate for the threat of COVID-19 pandemic, hand sanitizers, soap, and water. They also built hand washing infrastructure and hand sanitizer stations for houseless populations all around the world, not only for houseless populations, but also for workers and migrant workers and low-income communities in general. And they provided food to communities whose work was affected. So this is a little more outside of the WASH aspect, but somewhat connected because people had their ability to generate income limited due to the non-pharmacological interventions to have lockdowns or have some non-essential work suspended. And then also by raising awareness on how to prevent contamination. So how long to wash your hands for, how to do it. And also raising awareness on vaccine efficacy in the face of a lot of anti-vaccine narratives that we were being exposed to. And then finally, advocating for vaccine distribution and adequate treatment. So I'm moving to the key findings now, and I'm going to go over some of the more general findings on the two objectives before focusing on the civil society organizations. And it's very important to situate what access to WASH currently is and looks like in Brazil, and more specifically in the research locations that where I studied this phenomenon. So what I found was that most residents have access to piped drinking water, which is different than what we would expect in lower middle income countries, where piped water is a bit more limited. But what I found was that these connections were illegal. So residents created connections to the water mains where they were available so that they could access water for free, and they still utilized these connections. So what that means is that drinking water quality is often compromised, and that is connected to the main finding and the main concern among residents, which was that sewage collection and treatment is completely absent. So in this photo here in Japeri, one of the communities where I studied, you can see open sewer as part of the landscape, and it's close to the households as well to the right. So what happens is the combination of the lack of sewage collection and treatment with the improper, with the precarious materials that are used to create these illegal connections, contamination of the drinking water is very easy to happen. And so people experience reduced drinking water quality. And that, of course, is enhanced when floods happen, where the sewage, domestic sewage, untreated domestic sewage can more easily come in contact with these illegal connections. So for the objective one was where I was concerned with barriers and facilitators in access to water. So what worsens the current access to wash? I found that water shortage and limited supply was something that residents experienced a lot. They went 3 to 4 days every week without being supplied water. Flooding was something that made things much worse. And this quote here from one of the key informants, who is also a resident, exemplifies that. He says, "The storms worry residents a lot because the open sewer floods. It receives wastewater from everywhere, including the prison." There was a prison nearby, near to the community, and a lot of domestic sewage was generated by the prison. And so residents were concerned with that as well. And you can see here how the untreated domestic sewage passes through people's backyard. They're very close to it. And then finally, the damaged wash infrastructure, which facilitates all of these things to happen, not only because of the precarious materials that were used to build the connections in the first place, but also through the agency of time and other actors that the residents mentioned. And then I also spoke to residents about the reasons for persistence of these barriers, and they mentioned inadequate wash and housing infrastructure. So as you can see here in this community, there is no sewage collection infrastructure. The open sewer is passing through right through the middle of the community. And then the houses are also pretty precarious. So you can imagine what kind of limitations that poses to any sort of solutions the residents may come up with. An example is that some would try to store water, and they usually install the water tanks on top of the houses because they don't have much space to place them. I think here in the photo you can see a blue water tank, but some houses were so precarious that they could not place the tank there. It's 1,000 liters usually, and that is there's a lot of weight there, so they couldn't place it on top of their houses. Limited social capital, so I mentioned earlier, damaged wash infrastructure. So as part of that sometimes was linked to the action of other residents in the community that could sometimes purposefully destroy some of the connections. The residents weren't clear about what was the motivation for that, but it happened. And also limited social capital kept them from coming up with their own solutions. Negligence from authorities. As you can imagine, these communities are neglected because the services are not present. And unwillingness to pay for wash, sometimes because they couldn't pay for wash, and sometimes because they don't trust that the water quality would improve if they paid for it. And then for facilitators, really, they only mentioned the support of civil society organizations. In this quote, a resident says, "I now believe that the sanitation problem will be solved because we have a partner who is working with us. If it was up to the government, I wouldn't believe it. Our NGO is our partner." And occasionally they would have some government support, but only during elections when people in office were looking to get some votes from the communities. And then I was also interested in how wash inequities affected well-being, and I came in not with a fixed idea of what well-being meant, which allowed me to look at what well-being means to these communities. And of course, it included physical health and mental health, but they focus mostly on emotional health, their ability to deal with climate change, their sense of dignity. So in this quote here, we have a resident who says, "The other day I was coming home from the train station, carrying some heavy bags under the scolding sun, and I passed by that slope where people throw garbage. A bag came from up there, passing close to my face and hit the wall. When I looked to see what it was full of shit. I cried with hatred." So this is a photo of the slope where people get rid of solid waste. And as you can imagine, there's also no services of solid waste removal, collection. And then in this case, she's describing a person who probably doesn't have private toilets and used the flying toilets, which is to dispose of feces in a plastic bag and then throw them wherever they can't see. And so she felt a lot of hatred and angry, and she was angry, and she was also felt powerless in terms of what she could do. And I observed a lot of inequities, which geographical inequities that happened at multiple scales. These two photos here, they are photos from the same community, but different sub-neighborhoods. And in the bottom, you can see that there's an existing rainwater collection mechanism, even though it's damaged here with the branch used to highlight that there was a hole there. And this road is also paved, whereas on the top, you can see that the community is not paved, and they were dealing with a lot of mud from rain that happened about two days before this, which limited their mobility and also affected their sense of dignity quite a lot, because they wondered why certain communities would have access to pavement and theirs wouldn't. And these inequities were intersected by structural inequities such as classism, racism, and colonialism. The WASH inequities aggravated social stratification through stigma, affecting sense of dignity, limiting mobility, and a reduced sense of agency. One of the residents mentioned how she felt she couldn't go to the movie theater to watch a movie because by the time she arrived there, her shoes would be stinking of sewage. So this is an example of how it can affect other dimensions of well-being. And then finally, civil society organization WASH solutions. They were mostly, there were direct interventions, as you can imagine. Civil society organizations fixed or built WASH infrastructure. The photo on the right here shows a water pump installed on a water well that was built with support from civil society organizations. The community was located on a hill, so they needed more pressure for drinking water to reach their houses. And water donation was also something that happened in periods of water scarcity, happened a lot during the COVID-19 pandemic, but the leaders and residents were pretty aware that this was a short-term solution. And then there was political activism, which in my interpretation generated longer term benefits for the community in terms of accessing WASH. And this photo here on the bottom is of a water treatment station that was installed in the municipality of Japeri, where the civil society organizations had the more limited capacity to implement direct interventions, but throughout years, they advocated for the water company that serves the region and for the governments responsible for providing these services to build a water treatment station in the community. And after about 10 years of advocacy, they were able to achieve it. And now they impact a higher number of people. And then finally, intermediation and fundraising. These civil society organizations are very skilled intermediaries, and they also seek to raise funds for these interventions or for interventions proposed by other actors as well. So let's just take a closer look at some of these initiatives. The first one that I selected here is the water filtering backpacks. In this photo here, you can see that it's a little dark, but you can see that there's a water bag placed on the wall, and this lady is using the water bag to filter water and collect it in water bottles. And the civil society organization in my research, one of them was responsible for facilitating the donation, the installation, and the maintenance of these water filtering backpacks. They partnered with a social enterprise that produced and manufactured these bags. But they were only offering 100 units, so they had to select the families based on socioeconomic status and higher needs. And they also were responsible for following up with the families, and they had a social worker looking into whether or not these bags were having a positive impact on people's lives and access to WASH. And they found a reduction in WASH-related diseases like diarrheal diseases. And they were focused, this project was focused on improving drinking water quality, but it also had effects on affordability, because they noticed that people would collect water in a water tap that was communal, and it was where they were able to access water for free. And then they would use the bag on the way to their homes, and the water was already being filtered. So they no longer had to pay for water. Another initiative was the renovation of public spaces. One of the civil society organizations decided to renovate a community public square to improve leisure in the community, which is something that a lot of residents don't have access to. But in the process of doing it, they also improved the pipe connections, which were all passing through that public square. They were illegal pipe connections. The civil society organization didn't create them, but they intervened to make the water quality better, and also improving reliability for some families. And also by doing that, they installed materials on the public square that were able to absorb water during intense rainstorms. So it also contributed to flood control. And here in this quote, we can see that they say, we also renovated the hydraulic part of the square because it's where all the water connections to the lower part of the community start from. There are two pipes there. One is newer than the other, and houses connected to the older ones suffered shortages more often. We connected the two pipes to increase the water flow and reduce water shortage. We also used the draining material on the floor of the square, which helps absorb the rain and reduce floods. Another look here at the political activism and autonomy building initiatives, where we have, this is a photo of one of the key informants who kept very close, who registered government initiatives to keep them accountable for whatever they were advertising they were doing. And this is a sign of a, I won't try to zoom in because I'm using Teams sharing for the first time, and then I'm not really good with it. But this image here shows how much the government, the federal government, invested in the community to improve sanitation and to improve access to water. And they didn't see any change, so they kept these photos so that they can take these governments, the local governments and water companies to court and achieve things like the water treatment station that they achieved. And then in this quote here, we see how the key informant describes their political activism. He says, CSO2, which is their CSO, participates in a network of civil surveillance on sanitation and health, and we monitor the process of privatization of the water company. If they are meeting the targets, if the municipalities are being supported, we try to follow the news because there is no transparency. We participate in city councils for the environment, health, social work, school meals. We discuss the city and try to organize the social movements. Our institution defends residents' rights. And then in other communities, civil society organization 1 and 3, WASH was not their main mission. Their main mission was promoting education, income generation, culture, female and Black empowerment. But what they observed was that they could not do that if people are coming to their organization hungry and not being able to access water, you know, basic needs that they have in general. So they had to pivot to relief aid. So in addition to providing the service that they already provide, they also had to work on food security, WASH, overcoming trauma and violence, and steering the youth from criminality, because a lot of these communities are dominated by criminal groups that are responsible for drug traffic. So in this quote here, it came from, it says, people in extreme poverty only ask for things, food, clothes, a job. They can't dialogue. You have to work with them to understand how they'll first have access to the minimum, to food, regain their self-esteem, their dream, and then find employment so they won't depend on you anymore. This is very complex because it's a relationship established by the colonizer. And here there was another layer that we can explore in the Q&A session, which is that a lot of these communities are mostly populated by Black and Pardo people. Pardo is a term used in Brazil for people of mixed ethnicity, Black, Indigenous, and European. And so there's an aspect of environmental racism in these communities as well. And so this was important because autonomy is necessary according to these key informants, because they don't want the cycle to perpetuate. So they don't want to just do charity. They want people to be able to achieve a higher degree of autonomy and be able to access these services by themselves. And in this quote here, we see some of that being illustrated. The key informant said, today, the most important community leaders in any favela in Brazil are the churches. While we lack money, they lack a more polished, critical conscience. They continue to feed the culture of charity assistance, but they don't think from a perspective of autonomy. Don Elber Câmara, which is a religious leader, has a wonderful phrase: when I give food to the poor, they call me a saint. But when I ask them why they're poor, they call me a communist. So there was a lens here as well of understanding the root causes of inequities beyond the technical issues of accessing, having inadequate access to water and sanitation. There must be a political debate about why certain people don't have access to water and sanitation. And then these civil society organizations are very skilled intermediaries. And this quote here exemplifies that. One of the key informants says, before implementing the water filtering backpacks, we organized a breakfast with the residents. We explained the project step by step and people started understanding. So here they say how they received a project from an outside donor, a proposal of a project, but then they consulted the community to see if they were interested in that and also guarantee how they would implement the project. But they also liaise with other groups, not only the residents and outside donors. In this quote here, we see a key informant saying, we had to ask permission from the drug traffickers to install wells. Their relationship with us is respectful because the children and their families are here. They don't want the kids out of school or a social project. So here in this quote, we see how the role of the civil society organization as someone who is only bringing positive things to the community makes them being respected by groups who could pose some tension in the territory. So they're able to navigate those tensions and competing interests sometime. So they're able to bring services that otherwise could not be present in that community because wash companies would not be allowed. The public power would not be allowed. But I also found inequities even in the support of civil society organization. So in the capital, there was more support from civil society organizations. In this quote here, we see one of the key informants says, our community has close to 17 social projects, mostly led by dark-skinned women born and raised here. So there's a layer here of the racial components, but my focus is on the number of social projects in this community, about 17 social projects. Whereas in the more remote community, the key informant says, NGOs cannot survive in Japeri. There were several, but they all dwindled. This is because we're not in the center of power, of opportunities. Residents have so many needs that you can't expect the third sector to fulfill them all. So here he's touching on the issue that civil society organizations can be helpful. They will never be enough to fulfill all the needs, but also the fact that being in a more remote peripheral area, they are not at the center of attention, both from civil society from civil society at large, from donors and from the media and from the state government. So there's that inequity also in the support of civil society. So in conclusion, what is their role in WASH after all, right? So putting it in a summary, civil society organizations are direct interveners by creating and implementing their own projects. They're fundraisers by finding funds for their projects, but also for other projects from outside donors. They are advocates for bringing these issues to the public, to state actors, and by also promoting political activism and raising awareness in the communities about the power dynamics that are keeping them in the state where they find themselves nowadays. They're very skilled intermediaries. They're also fact checkers, which is something that I didn't explore much here in this presentation, but they oppose the official data on access to water a lot and access to sanitation by saying that the situation is much worse actually. And then they also say that despite their ability to do these things, they're not capable of doing it alone. And the residents themselves are aware of this. They say, we can't demand something from a private initiative when they have no obligation to do so. They're here to help us so that we can live a better life, but they don't have that obligation. We can't live our whole lives on the benefit of an NGO, whereas who had to take care of our infrastructure are the public authorities. And I find that this very own perception from the resident is a result of the initiative that this civil society organization had with these residents in Rio de Janeiro to promote debate about this. So they had a group of residents that met every week to talk, bi-weekly to talk about these issues, and they were very aware of these power dynamics. So briefly going over some of the implications here. Kelsey, I hope that I'm good on time. Good, okay. So there are, of course, some implications. The first ones are to civil society practice. I found that there's a lot of room for partnerships between these local civil society organizations. They have varying degrees of expertise in areas of actions. Some of them have higher expertise in fundraising, others in political activism and resident engagement. And the civil society organization operating in the more urbanized municipality, which is the state capital, they were really good at fundraising, but the social mobilization aspect and the political activism, not as much. Whereas the organization in the more rural, remote community was really good at it. This is a photo of a petition that they collected with many signatures from residents, and they took to court to judicialize the process of the fact that the local governments are not supporting these communities, and then they achieved that water treatment station. So even the ones that are more deprived are able to teach something. And these civil society organizations, due to their ability to navigate different interests, they're also able to facilitate behavior change conversations with residents, governments, and wash companies. One example of that is in the aspect of paying for water. I explained earlier that residents they lack trust in these actors, so they're unwilling to pay for water. So when the water companies install these water meters here in the photo, they destroy them. That's why they have grids here. The water company went there and installed the grids, so they couldn't destroy them. And this is because they don't trust them, because they think, number one, they don't, by not having pavement in their sub neighborhood, they don't think that the water that they are being supplied is going to be of good quality. And they're also installing these water meters on the existing precarious connections that the residents built themselves. So in this case, understanding this priority would allow these civil society organizations to talk to the appropriate actors, which are the municipal governments, to build the infrastructure necessary for the communities to trust the water companies, in this case, pavement, which is not a responsibility of the water company. There's also implications to policy. I mean, assuming that the leaders representing, sitting in the state and local governments would be interested in promoting social change, the municipal governments could enforce their contracts with the wash companies and build infrastructure to support the services, like I just mentioned. And the state government could implement civil society proposals to extend and reinforce reduced fees for low-income families. These proposals already exist, and they are proposed by the civil society organizations, but they have not been signed into law by the state government. And in addition, I think that the municipal and state governments could give more priority to these civil society organizations so that they can learn from them, because they truly understand the territories and the needs of these communities, and they're able to liaise with these actors. I also made a point that HO and UNICEF, who are the international organizations who put together the joint monitoring progress report on household drinking water and sanitation, should find alternatives to report WASH data with more nuance, because Brazil is considered a country with advanced access to safe drinking water. But when you go and look into the communities who are said to have access to safe drinking water, they experience all these inequities. And then to wrap it up, some of the future research I hope to do in this area of knowledge is on studying more of the civil society organizations in WASH in other high and upper middle income countries, to see if different patterns exist in these other countries. Continuing engaging in an integrated knowledge translation approach, like I explained at the beginning, with the research partners. In this sense, to communicate these findings to the partners, have them implement them if they are interested in it, collect feedback on it, which informs more research. And then one aspect here that I would be very interested, not so much related to civil society organizations, even though they have a lot of projects in female empowerment, which would be to look at the aspect of gender in WASH in high and upper middle income countries, because there's a lot of research on gender in WASH in low and lower middle income countries, but in this research where the objectives were not focused on gender, the gender theme came up a lot. So I'm interested in having something more tailored and focused on that in the future. And I can, if anyone has interested in that, I can explain what were the gender themes in the Q&A session. So that's all. Thank you very much.